And we talked a lot about spine. So common things like you said, if you have really severe arthritis and we do physical therapy, sometimes it will get worse or it certainly won't get better. Same thing with a disc herniation. We try as best we can to handle that conservatively, but a lot of times we have to refer that out. Let's talk more about shoulders and knees.
Yes.
So patients that we have that have probably some similar things, severe arthritis or some kind of maybe a structural issue. What are the common things that you see? When we see them for physical therapy, we're like, hey, doc, we tried our best for 6 visits. It's not getting any better. Let me, you take a look at it and see what you see. What are common things or issues in the shoulders and the knees that are hard to overcome in conservative physical therapy?
Absolutely. That's such a great question because the joints are very interesting because they tend to like carry stuff in and they're very isolated. So one of the things that I tell patients that is very common, especially joint spaces like the shoulders, the hip, and the knee, those spaces are pockets. And the shoulder, for example, has a lot of pockets. And like just like the spine, when you have a pocket, you can fill it up with something. So during a state where the shoulder is injured, you have a lot of inflammation accumulating in those pockets. Again, the generic term is arthritis. So that presence of inflammation in a pocket in the shoulder, say for example, there's a bursa in the shoulder called the subacromial bursa. Sounds very fancy, but it's just a space in the shoulder that when it gets very inflamed, that pocket can be a source of pain. So very commonly, you can see arthritic presentations. You can also see structural problems like a tear in ligaments or tendons or cartilages that are connecting spaces together, and not just any space, but vital spaces. And it's not uncommon when you see those, we can offer treatment options. And one of the things that we do is very similar to the spine. If it's an arthritis or an inflammatory process, you can actually inject steroids. There are a lot of patients that lean more towards a stem cell regenerative approach, which I think is very controversial, but also very efficacious when you work with the right provider. I've been very fortunate to sit as an editor for one of our stem cell journals in pain management. But instead of injecting steroids in the joints, you can utilize things like PRP, like platelet-rich plasma, and it's taking advantage of your body, the healing parts that your body creates every time, and using it to actually heal those joints. You can utilize it in the shoulder, the hips, the knee. So the moral of the story is for inflammatory responses, you can treat with steroids. You can also treat them with PRP. The beauty is that when you use stem cell products like PRP, you can actually regenerate and also enhance structural components of the joints. The other thing you can also see is nerve related problems in the joints. The joints are surrounded by nerves, the shoulders, the knees, the hip. So very similar technique that we use in the back is we can isolate the nerves and try to deaden the nerves or at least reduce their sensory function, and that can help with pain.